Okay, I think now we're gonna be live. I don't know if it's telling you in your screen.
Yes.
Okay, that's really good.
Yep.
Okay, so what happened with Carla? I don't know. What happened with Polly? Salome, is that your friend?
Yeah, she's my friend. But nowadays she is in the internal medicine now rotation. So that internship couldn't be available all the days. So I
Uh,
was thinking about that, but really I don't chat with her. So I will chat with her today.
okay, I understand. Oh, hi, there is Carla.
Hi, Carlita.
Carla, can you hear me?
Good afternoon, everyone. Excuse
Oh,
me, I'm
good
late.
afternoon.
Good afternoon.
Okay. Oh, that's pretty good. So we can start now.
Yeah.
Okay, so we're gonna continue. Can you see my screening?
Yes,
Yeah,
I can
please.
see it.
Okay. Okay, that's pretty good. So we're gonna talk about systems, diseases, and symptoms, and this is part 2. Now we have a a little bit for introduction would be the childhood. I don't know if you are attending more children than adult people, or in your areas you don't usually do that.
It's frequently to have
Got it.
children in the consult.
Most than adult people in your consultation now where you
I
work.
think yes.
Yes, for me too.
Okay. Okay. So milestones. As we know, childhood is a period during which a person is a child. It ends with puberty. The onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestones in a child's development and the ages at which they usually occur are sitting by 9 months, crawling by 12 months, first words by 18 months, walking by 18 months too, and talking 2 word sentences by 3 years. I don't know if you are agree with this description.
What is the meaning of crawling?
Gatear.
Got your okay.
Yeah. Maybe you, um maybe you that work with children know more about this, because I think in the primary attention, we usually try to children a lot. Is
Okay,
that
but tunes, yes.
yes, right?
Yeah.
It's the first thing we do, even in the dentist areas. So it's the most common to
Mhm.
attend. Okay. And common infectious diseases that they have, we used to have too. Can you read it, Salome, please?
Sure. Morbidly rubiola, common name measles.
Okay.
Rubiola, Herman measles, varicella, chickenpox, infectious parotitis, mumps, pertussis, whooping cough, acute laryngotracheitis croup.
Yeah,
Es-
tracheitis.
okay, scarlatina, scarlet fever, rheumatic fever, tetanus, lockjaw,
Look,
poliomyelitis,
look, Joe.
lockjaw, and poliomyelitis, polio.
Okay, thank you. So as we can see, we don't even know these names, right? We know most of them, I think, but they mean the same. Okay.
Mhm.
For example, rubella or German measles. I was looking for measles, and it's like salampion, what we call,
Mm,
okay?
okay.
Like infectious parotiditis and mumps are paperas, as we
Oh,
know. In Bolivia, for example, we know like paperas or parotiditis. I don't know in Ecuador. Is that the same?
yes, it's the same.
Okay. Okay, here we have tetanus, and the common name is lockjaw, but I was looking for that, and lockjaw is like a trismus, when you cannot open your mouth as you usually do. Okay, you have something that pressure against, and you cannot open as you can do usually. That's a trismus, lockjaw. But I don't know if it is related to tetanus. I don't know the
Yes,
symptoms. Do you
it's
know?
a characteristic symptom.
Okay, I didn't know. That's interesting, guys. Okay, so celiac disease, some medical language notes. I don't know, Liz, if you can read it, please, the text on the left for me, and Carla, you can read the notes on the
Okay.
right.
Okay.
Colic disease is a disease of the small intestine caused by sensitive to gluten. It can present at any age, but in infancy it appears after weaning onto the cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is the light growth and the light poverty, leading to short stature in adulthood.
Okay,
Sensitivity to having a negative reaction to weaning, changing the diet from milk only to solid foods. Clinical features, the symptoms and signs of a disease. Malabsorption, poor absorption. Malnutrition, poor diet, nutrition. Objective, malnourished.
yeah,
Malnourished, it's
malnourished.
malnourished. Try, grow strongly. Distension, swelling. Delayed, later than expected. Failure, when something that is expected does not happen. Stature, size, especially height.
Okay, so as we can see, there are some words that we didn't understand, but I think it's more clear now. I don't know if you have any questions about this. For example, maybe weaning, changing the diet from milk only to solid foods, and in we have in this side after weaning. It could be después del destete, es como quitarle el biberón, ¿no es cierto?
Ah, yeah.
Yeah.
It's something like that, okay? I don't know if you have another question. I think the other things are clear. Or you have any questions? But I think that you use usually these words, or you will need to use these words in primary attention, no, or in your residence, maybe. So it would be better if you write it down. You tell me when we can change the slides.
I wanted to ask about swelling. I thought it was something like when it's infected, it swells, but I'm not sure if it also means a distension, abdominal distension.
Yeah, it's like something grows, some tissue grows because it's swelling. When you, I don't know, when you push or you have an accident or something, you get an inflammation. It would be a synonym of swelling, like hinchazón.
Okay, okay. Thank you.
You're welcome. Okay, so I think it's pretty clear here.
Yes.
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 Okay. So the endocrine system. Ah, can you read it, Liz, please?
Okay. The endocrine system. Excess and deficiency. An excess too much or deficiency too little of circulating hormones cause a wide range of medical conditions. For example, hyperthyroidism and hypothyroidism, where there is an excess of a hormone. On-form treatment consists of giving the patient something which inhibits the production of hormone, as in the use of carbamazole to treat hyperthyroid. How I have to pronounce hyperthyroidism?
Hyperthyroidism.
Okay, hyperthyroidism. When a hormone is deficient, maybe by replacement therapy. For example, injections of insulin in the treatment of type 1 diabetes. Sufferers of type 1 diabetes are deficient in insulin.
Okay, so we are. I think we remember like the endocrine system and their diseases, and the most commons are hyperthyroidism and hypothyroidism, and it's because of the T4 and T3. So we're gonna see now how does it work. Carla, can you read number 1, please?
Okay. TRH, thyrotropin releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulating hormone, in the pituitary. TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4, thyroxine, and T3, 3-iodo-thyronine. I'm not sure.
Are
3-iodo-thyronine.
you 309? Yeah.
And also to release stored hormone, producing increased plasma levels of T4 and T3. T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion.
Yeah,
Oh,
TSH secretion. So I think it's like a scramble or something. I don't know. But we know that because of these hormones, T3 and 3 and T4, it happens that this disease is so much common. I don't know if you remember about the signs and symptoms of these diseases, especially their difference. Do you remember? Can you tell me?
Mm.
For example, for hyper, how is it? Hyperthyroidism.
Uh-huh.
Um, Maybe the person is nervous all the time. The pulse rate is very higher. The person feel uh, very hot all the time. Um, eh, eh, em, I don't remember how is sudoración.
Sweaty.
Sweaty, yes.
Yeah.
And maybe the eyes is a little bit like out.
Bigger? Yeah, bigger and
Bigger
out.
and out.
I know. Okay. Okay. It's like a face moon. I forget. Is that right?
Sorry, I can hear you because the internet.
Like like the face is very in a unique form, like a circle. That's why we call
Ah,
a face
full moon
moon. Facet.
is like if the face is like full moon, I think it's for hypothyroidism. Oh, teacher has gone.
Yep.
We have the hour free.
Crazy hour.
Hello. I'm
Hello,
so
teacher.
Hi,
sorry.
teacher.
I come back. I don't know what happened. Well, my internet, I don't know. Oh my God. I was hoping that this is not happening. Okay, can you see my screen?
No yet.
No.
Okay, I will share with you again. Well, what were we saying?
That we weren't in a free hour or crazy hour because you gone.
Yeah. Okay, so let's make a resume of these negative feedback systems. They say that TRH is secreted in the hypothalamus and triggers the production of TSH. And we know the name. We can read it later. Okay? And what does triggers mean? It's like when something is shooting, it's like the production of TSH is very high in that very moment, in that specific moment. Do you understand the meaning?
Yeah, I
Yeah.
searched on internet and I found it like disparadores.
Yeah, it's like okay. Then TSH stimulates TSH receptor in the thyroid, the increased synthesis of both T4 and T3, and also to release stored hormone. Do you know stored like when you cuando almacenas stored hormone, okay, producing increased plasma levels of T4 and T3. Then T3 feeds back on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. Okay, I think it's a system a little bit complex, but I know that we'll see someday. I don't know if someone of you is interested on this endocrinologist, on being an endocrinologist or something like that, or there's a need of you to be more interested in this way to do your specialty.
In my case, not at all.
No.
Is there a need? Ah, oh, so congratulations, guys. Okay, let's continue. Do you hear me?
Yes.
Okay, I'm so sorry. A car just passed. Okay, an enlarged thyroid gland is called a Gauthier. It's like a French word. I don't know, Gauthier, okay? Something like that. The enlargement be diffuse, involving most of the gland or localized, limited to a particular area, as in a solitary or single nodule. The increased blood flow in diffuse enlargement, for example, in Graves' disease, may give rise to a palpable thrill, vibration felt with the hand, and an audible bruit, noise heard through a stethoscope over the gland. So do you understand what am I talking about? What is,
Bossio.
yeah, is the name we use in Bolivia. I don't know if in Ecuador is the same.
What's the name? Sorry, I didn't listen.
Ocio.
Ah, yeah, it's the same.
Okay, but if you look in on internet for the traduction, you will find coto, and I think it refers to the part of your neck that is with inflammation. Okay.
Okay.
Okay. So Salome, please, can you read it?
Sure. A letter for referral. Mr. David's doctor has referred her to an endocrinologist. Dear doctor, I will be grateful if you will see this 50 years old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as overactive, and at first she thought the weight loss was due to this. But more recently, she has developed palpitations, diarrhea, and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hyperthyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, with sweated palms and fine tremor of the hands.
Okay. Thank you very much. So we find new words. Overactive, for example, that means more active than is usual. Palpitations, that is awareness of rapid or irregular heartbeat. I'm sorry. Then we have fine tremor. That was what you say in what you were saying, Liz. Very slight involuntary movements. Ah, no, you said sweaty palms. I'm so sorry.
Yes, sweaty and nervous.
Yeah, heat intolerance. That is the inability to cope with high temperatures. That they cannot stand high temperatures. Okay. Okay. So I don't know if you have any questions till here.
I have one question. In the section where it said palpitation, it says awareness of rapid or irregular heartbeat. So look at in on internet, and awareness is like conciencia. So I want to try to translate, and I don't find too much sense, like conciencia de un rápido o irregular latido.
Okay, I understand. In context, it will mean like people who suffer of these palpitations will feel this that the beat it's happening so fast. Okay, but
Yes.
the traduction, of course, it's not so
It's not
helpful for
literal.
us. Yeah, it sounds like nothing with this, nothing happens, no? Right.
Okay, I
Okay.
get it. Thank you, teacher.
Okay. Then we're going to go to the eye. Okay, so we have parts of the eye, just to remember, okay? We have the eyebrow, the eyelid, the eyelashes, pupil, and iris. What change the color of our eyes? Yes? I thought you have a question. Okay, do you understand eyelid?
Párpado.
Párpado.
Yeah, very good. We're going to use it so much. Okay, so we had the examination of the eye. Some of you or someone makes some, I don't know, someday an examination of the eye.
Yes, looking for a strange body.
Yeah.
That's the most common examination, I think.
Okay. Okay, so look for squint, or it's called strabismus too. Drooping of the upper lid, or ptosis, or oscillation of the eyes, that it's called nystagmus. I think it's very common, or it sounds almost the same in Spanish. Do you remember?
Yes, nystagmus.
Yeah.
Equal.
Okay. In lid lag, the upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. Okay, maybe a little bit tremor, or what do you think? The meaning of lid lag is the upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. So I think when the patient is it's just looking down the floor, it starts to tremor the lid. He cannot control this. Okay.
Okay.
There is no I don't know if it's a word, a traduction exactly of lead lag. If you find, please let me know.
Retraso de la tapa.
That's why I don't know if it's exactly what, what we are looking for. We don't understand. It's better in context. So I think it's more like a tremor in the lid when the patient is looking down the floor. Okay?
Okay.
Okay. Next, examine the pupils and note whether they are equal in size, they are irregular or in outline, evenly circular, they are abnormally dilated, large or constricted, small, they react normally to light accommodation, focus on near objects. To test the reaction to accommodation, ask the patient to look into distance. Hold your finger in front of their nose and ask the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also for cataract, that is an opacity of the lens. So, in which disease do you think, or which problem you can notice by watching that their pupils are not equal in size?
Neurologic disease.
Yes, a trauma.
Okay, like what? I don't know. Can you explain me a little bit?
A very important trauma in the brain.
Okay.
Maybe when the pupils are very, very irregular, we think in cerebral death.
Wow. Okay. It would be the same in where is constricted, I think.
More when are irregular.
Okay.
Because constrict maybe means constrict or dilated, yes. Maybe means other thing. For example, when a patient consumes drugs, the
Yeah.
pupils are dilated, for example.
Yeah. Okay. And when they react normally to light and accommodation, but it means that it's okay. But when they are not react normally, maybe something, I don't know, could be for using medication too.
Yeah,
Yes,
could be drugs.
Okay. Okay, that's pretty good. Then we have retinopathy. Okay, Carla, can you read this, please?
Excuse the noise, there are many cars going through. Okay.
Oh, no, don't worry.
Hypertensive changes in the retina can be classified from grades 1 to 4. Grade 1, silver wiring, increasing the light reflex of the arteries only. Grade 2, grade 1 plus arteriovenous napping, indentation of veins where they are crossed by arteries. Grade 3, grade 2 plus flame, shape hemorrhages and cotton wool exudates. Grade 4, grade 3 plus papilloedema.
Papilloedema. Okay. So we know now that the retinopathy has 4 grades. And I don't know if you have any questions with this.
yes, I have one question. What is the meaning of indentation in the grade 2?
Indentation. Well, I use it a lot in my career, in my profession as a dentist, because the teeth um, are uh, are make pressure on your cheek, okay, on the cheek, so it leaves a little bit a little marks, and I don't know if it works for the eye. Let me look for. Okay, it will be hendidura de la vena,
Mm,
like I understand here that the arteries make pressure on veins and
suffer damage by
yeah, and
them.
let some marks. Okay, that is
Mm,
an indentation. It's almost the same with teeth on the cheek, but of course it's because of pressure.
okay, thank you, teacher.
Okay, what else? We have grade 2 plus flame-shaped hemorrhages and cotton wool exudates. Cotton wool, it's like algodón de lana, lana de algodón, lana de algodón.
Mm-hmm.
Okay, it might be the distribution of the veins and arteries. Okay.
Yeah. Okay.
Okay. So we have any more questions here, or can we pass to the next slide?
What is nipping?
Nipping.
I looked in that and was tipping in Spanish, but I don't know what mean.
Okay. Arteriovenous nipping. Let's. It could be like pellizco arteriovenoso. Okay.
Es estrechamiento.
Okay. It's a better word for this.
Thank you.
Thank you.
Thank
Welcome.
Okay. So we're gonna go to the gastrointestinal examination of the abdomen. Here is an abstract textbook description of how to examine the abdomen. Okay, I know that you are more in, so you're gonna be the difference, or if it's not, and you're gonna tell me later. Okay.
Okay.
Note if the abdomen is distended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting, dullness, percause or tap. That means percause or tap. First with the patient lying supine, flat on their back, and then ask the patient to lie one side and percuss again. If fluid is present, the dull note heard on percussion moves. Palpate each region, feeling the tenderness, pain when touched. That is the meaning of ness, okay? Or masses. That means palpable enlargement of tissue. Note also any guarding or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. Listen for vowel sounds. So, in your consultation, guys, is the same
Mm,
or is not in this order, but you look for the same things?
yes, we look the same thing for we. Um, for example, in my case, I use another order. For example, the first one I had to auscultate the abdomen because the doctors teach me that if I percuss first, I will alterate the the sounds of the abdomen.
Okay, okay. What about you, Carla?
Yes, in medical school, they teach us to make always the auscultation first, for because we don't want to induce intestinal movement.
Moments.
But
Ajá.
we increase when we palpate first, so we begin with the auscultation.
Okay, that's pretty good. Here says guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. That is real? I didn't know that it was because of the anxiety that causes intestines movements.
Maybe yes, there exists an illness that called irritable bowel or es colon irritable in español.
Okay,
And it's influenced by the sense or the feelings.
okay, that's interesting. Excellent. Something else that you can add, Salome?
No, because I don't valorate the patient.
Okay, okay, it's okay. In my case, I was thinking about the saliva that patients cannot control it too. And I told him that they need to relax in order to maintain the saliva inside the glands. So they need to relax. Patients are so nervous and they can cause a lot of reactions there, right?
Mhm.
Okay. Then we have the faces. I think this is not a, this is not a topic that we usually talk about. I don't know if doctors do this or nurses. I think it's more for the laboratories, but we have to know that there are several words for the faces. Okay,
Mhm.
Uh, doctors sometimes say there was blood in the stools. Have you passed black stools? Bowel movement is used to refer to defecation. Have you bowels moved today? Have you had a bowel movement today? And patients sometimes say, my emotions have been very loose lately. Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habits? How often do you open your bowels? Are you going to the toilet more often than normal? Okay, so of course there are signs in feces that make us know that there is some problem, right?
Mhm.
Which is the most common, or what kind of problems do you attend because of these signs?
I have seen very loose faces very loose lately and stools with blood.
Okay, and what is a loose what is a motion that is loose? In which disease, or what is causing that?
Estreñimiento, ¿cómo es en inglés?
Constipation.
Yeah, patient.
Constipation. Yes.
Okay. Okay, what else?
For example, constipation when the person don't eat too much fiber. No, fibra.
Yeah, fiber.
Fiber. It's okay. I thought I was telling fever.
No, fever is like
Yeah, but yeah,
yeah, of your
fiber.
temperature. Yeah.
And stools were with blood when the patient has gastrointestinal hemorrhagic.
uh, and it's so dangerous when it's like that, right? It means
Yeah,
Yeah.
something worse.
yeah, it's dangerous because you are losing blood. And you don't know how to much, so you have to do exam, a blood exam.
Thank you. Something else to add?
Uh, we ask a lot of diseases when we talk about uh, treatment, a post-treatment of surgery, because
Okay.
we take it like a good sign of rehabilitation. If they don't poop, like we say here,
Uh,
uh, they maybe have a, intestinal pus. I'm not sure how to say it.
uh,
Uh, uh,
what do you want to say?
um,
Maybe the dehydration?
no, no, no. Like, um, oh, I
Can you
forgot.
say it in Spanish? We're gonna find out.
I forget it in Spanish. I
Oh, it happens. It happens. Don't worry.
like parada intestinal, maybe. Like intestinal pus.
Okay, I understand now. I don't know if it's called like that, but okay.
They aren't progressing as they have to, so they maybe have to re, like go again to another surgery. That's why it's important, the physics in surgery.
Wow. Okay, I didn't know. Bowel stop. It's like that. Just as easy as that.
Yes, that's the thing.
Bowel stop. Okay. Okay. So can you read it, please, Salome? The left side.
Okay. Change in bowel habit could be constipation, hard, infrequent stools, or diarrhea. Frequent, soft, or liquid stools. The color can vary from black, due to altered blood as in melena, to yellow, gray, or even white. Melena, melena is right?
Yeah, Melena.
Okay. Melena stools are often described as tarry. Like tar, the black sticky substance that is used in road making.
Okay. And can you read the right side, please, Liz?
Sure. Uh, the stools may be red when fresh blood is present. Blood that can only be detected with a special test is called fecal occult blood, FOB. When there is a high fat content, the stools are pale and are sometimes described as clay-colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale.
Okay, thank you. And we have our scale: hard, formed, semi-formed, soft or loose, liquid or watery. Okay, so you can put in this um, in this scale,
Scale.
yeah, the kind of stools that people may describe, okay, in order to find out which is the correct treatment for his or her disease. Okay, so you have any questions here, or is that everything understand?
What is the meaning of bulky?
Bulky, where is bulky? Okay, stools that are large in volume are described as bulky. So it's large in volume.
Okay.
Okay. Till a few years ago, I didn't know that this description was really important to know a different kind of diseases, right?
Mhm.
Yes.
And now, well, it works more for doctors, but uh, okay, something is oh, that's pretty good. Thank you. Okay, let's continue with gynecology. Okay, the female reproductive system. And we will just remember the parts of our system: fallopian tube or salpinx, womb or uterus, okay, ovary, neck of womb or cervix, and vagina. And then each one of you could read a paragraph, please. I don't know who's going first.
Me.
Okay, Salome.
Okay. A period is the common name for a name for menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP 2/52 ago means that the last menstrual period was 2 weeks ago.
Okay, thank you. I'm so sorry. I just made a mistake. This is means, okay?
Means okay.
Yeah. And the word menarche, okay? Menarche.
Menarche, okay.
Yeah. Thank you. Then, Carla, can you read it?
Yes. The menstrual cycle or length of a frequency of periods is usually written in the form 4/28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. prolonged. The term heavy periods means excessive blood loss. Menorrhagia, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation.
Yeah, thank you. Here, the same. I just ate a word, okay? I'm so sorry. And it's menorrhagia.
Ah, okay, okay.
Okay. And the last one, please, Liz, can you read it?
Sure. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweats.
Okay, thank you very much. I think this is a resume of what happens with us during our lives with menstruation. Okay, so I don't know if you have any question of this or you just remember and now you know how is the pronunciation, because I understand and I know that most of the words are pretty much alike the words in Spanish, right?
Yes, those are similar, most of
Yeah,
them.
yeah. For example, passage of plots here we have. That means coagulated blood. Then what else? Which word?
Mm, 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 mm.
Fleashes, hot fleashes at the end.
Hot flashes. It's a sudden sensation of heat, like in temperature. You know, maybe you feel like you got fever, but
Mhm.
it's not true. But people feels at that age that because of climacteric or menopause,
Okay.
but just in episodes.
Okay.
Hot flashes. Then we have a gynecological consultation. A gynecologist is talking to a 30-year-old woman. Okay, so who's gonna be the gynecologist and who's gonna be the patient, please? I need to.
Uh, okay, I will be the patient.
Okay, so
Apologies.
the first five, please, Liz, and the other ones, please, Carla.
Okay. Uno, dos, tres, cuatro, cinco. The five first one.
Yeah, please.
Okay. Are your periods regular?
Yes,
How often do you get them?
every 4 weeks.
How old were you when you started to get them?
About 12.
When was your last period?
A week ago.
Okay. How long do the periods last usually?
4 or 5 days.
Would you say they are light or heavy?
Light.
Do you get clots?
No,
Do you get period pains?
not really.
Is there any discharge between the periods?
A little.
What color is it?
White.
Okay, very good. Thank you very much. So I think it would be the most common questions for a patient, right? In order to know what is going on with this hair menstruation, and what would be the problem, or maybe just a control. Then the last thing, contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women. So I think we all know all of these tools, right? But
Mhm.
I really don't understand in this diaphragm or cap. How does it work? Do you know?
Not exactly.
Okay, so
It-
it would be a homework for tomorrow. Okay,
Okay.
okay, and we're gonna talk about this tomorrow. I will give you a little questionnaire I will send to you. But please first, can you answer these, please?
Okay, teacher.
Okay, very much. So if you have any questions of this class, you can tell me tomorrow,
Okay,
and
teacher.
we're gonna solve together, okay?
Okay,
Okay.
teacher.
okay.
Okay, it was nice talking to you guys. I hope you have a great night. See
Thank you,
you
teacher.
tomorrow then. Oh, who's gonna be first? I'm so sorry, I was forgetting that.
I want to go first.
Please?
It's
Yes.
your turn, Liz.
Yes.
Okay. Liz at 6 o'clock. Then
Okay.
who's gonna be second
I
at
keep
6?
the
Carlita turns, I think.
Okay. Carla 6:15, and then it's okay?
yes, yes, yes. It's
Okay.
okay.
And Salome at 6:30.
30? Okay.
Okay. Okay, guys. So it was nice talking to you. Hope you have a great night. See you tomorrow then.
See you
Thank
tomorrow,
you.
teacher. Bye, guys.